Welcome to the Deep Dive. Today, we're going deep on something super important in healthcare, but it often gets, overshadowed by all the flashy new medical discoveries.
Right.
We're talking about empathy
Yes.
in the doctor-patient relationship.
It's interesting, medicine has always been about healing, obviously.
Right.
But we're really starting to understand that real healing, like deep healing, it needs more than just, the technical stuff.
Totally.
It's that human connection, that feeling of being truly heard and understood by your doctor.
Yeah.
That can be just as powerful as any medicine.
I love that.
Yeah.
And we've got some really fascinating material to dig into today.
Yes.
We're starting with AETCOM 1.2,
Okay.
which is this module designed to help medical students develop empathy.
Interesting.
And then we're going to look at some recent news stories from India
Okay.
that really highlight the very real challenges doctors face when they're trying to balance empathy with
the crazy demands of their profession.
Those stories are really eye-opening.
Yeah, they are.
They really show the emotional tightrope that doctors walk every single day.
For sure. But before we get into those stories, let's dig into this AETCOM module. It seems like it goes beyond just the basic definition of empathy.
It does.
And actually gives medical students real tools to use, right?
It does.
Yeah.
One of the most important things AETCOM 1.2 emphasizes is understanding what it really means to be a patient.
Right.
And they do this by encouraging students to really think about the qualities and roles of a physician.
Yeah.
Not just in terms of medical expertise, but also in their ability to show empathy in those patient encounters.
Gotcha.
Yeah.
That makes sense. But how do they actually teach empathy?
Right.
Isn't it something you either have or you don't?
That's a great question, and a lot of people ask that.
Yeah.
AETCOM tackles this head on.
Suggesting that, some people might be naturally more empathetic.
Right.
But it's also a skill you can learn and improve, like any other skill.
Interesting.
For example, they have this really interesting case study.
Oh, okay.
Where a doctor, just by asking empathetic questions, was able to uncover this crucial detail about the patient's lifestyle.
Wow.
Something they hadn't even considered at first. And this tiny little detail ended up having a huge impact on the diagnosis and treatment plan.
So it's not just about being nice.
No.
It's about using empathy as a tool to get information.
Yes.
And make better diagnoses.
You got it.
Wow.
The manual even goes into this system called the Empathic Communication Coding System.
Hold on.
Yeah.
A coding system for empathy.
Yeah.
That sounds so technical.
I know, right? It sounds really complex.
Yeah.
But it's actually quite practical.
Okay.
It breaks down empathetic communication into these key elements, like acknowledging the patient's emotions, building that sense of mutuality and partnership, and using both verbal and nonverbal cues to show you understand.
Okay, so it's giving medical students a framework to understand and practice.
It's empathy, yeah.
I'm curious, what kind of verbal and nonverbal cues are we talking about here?
So the module gives specific examples.
Okay.
Like a doctor might say something like, I understand this must be a difficult time for you, to acknowledge how the patient's feeling.
Right.
Or they might use nonverbal cues like making eye contact or leaning in slightly just to show they're really listening.
Right.
It's all about creating a space where patients feel heard and seen.
That's so interesting,
Yeah.
I remember this one time I felt completely dismissed by a doctor.
Oh, no.
I was describing my symptoms.
Yeah.
And he was barely even looking up from his computer.
Oh, wow.
It made me feel like just another case file, not a real person.
Yeah.
With real concerns.
I think a lot of people can relate to that.
Yeah.
And it just shows why this training is so important.
Right.
AETCOM emphasizes that empathy isn't just about making patients feel good.
Right.
Although that's a great side effect.
Yeah.
It's about fostering a sense of agency and shared decision-making, which ultimately leads to better health outcomes.
Because when patients feel understood and respected, they're more likely to actually follow their doctor's recommendations.
Exactly.
And participate in their treatment plan.
Exactly.
Right.
But as we mentioned before, there's another crucial part of this discussion that AETCOM addresses.
Okay.
It's the concept of equanimity.
Right, equanimity.
Yeah.
Now, that's where things get a little tricky, don't they?
They do.
Yeah.
Yeah.
How can doctors, maintain empathy for their patients without getting totally emotionally drained and burned out.
Yes.
Especially in these high-stress environments.
That's a critical question.
Yeah.
And that's where those news stories from India become so relevant.
Okay, let's dive into those. I remember reading about patients attacking doctors in Mumbai, Hyderabad, and Kolkata.
It's disturbing.
It is. It's very disturbing.
Yeah.
What do you think those stories tell us about the challenges doctors face?
Well, I think they're a harsh reminder
Yeah.
of the huge emotional burden that doctors carry.
Right.
Especially in healthcare systems that are often understaffed and under-resourced.
Right.
They're constantly exposed to suffering.
Yeah.
And then you add the pressure of making life or death decisions.
Right.
It can be incredibly overwhelming.
It's a lot.
It is.
It makes you wonder if empathy,
right,
while essential, could actually contribute to burnout.
Absolutely.
If it's not managed carefully.
Yeah, if you don't have that balance,
right,
that's where equanimity comes in.
Okay.
It's not about suppressing empathy.
Right.
It's about finding a way to balance compassion for others with self-preservation.
Right.
AETCOM describes equanimity as the ability to step back from the emotional intensity of a situation to maintain your own equilibrium while still being there for your patient.
So it's like finding that sweet spot where you can connect with your patient's suffering without letting it completely overwhelm you.
Exactly.
Right.
And the module doesn't just define equanimity. They actually offer practical techniques for building this skill.
Oh, cool.
Like mindfulness practices and strategies for setting healthy boundaries.
So they're giving doctors tools to replenish their empathy reserves, so to speak.
Exactly.
So they can show up for their patients. Without sacrificing their own well-being.
Exactly.
That's awesome.
But it's not just about individual practices.
Right.
It's also about systemic change.
Yeah.
We need to look at the structures and policies that contribute to burnout. Things like unrealistic workloads, inadequate staffing, and all the bureaucratic hurdles.
It's a lot.
It is.
You're right. It's about creating a culture of care.
Yes.
Not just for the patients.
Exactly.
But for the healthcare providers, too.
Absolutely.
This brings us back to AETCOM's focus on equanimity.
Yes.
It seems like it's not just an optional add-on, but like a vital tool.
It is.
For doctors to deal with the emotional demands of their job.
Absolutely.
And to protect themselves from burning out.
Yes.
The module even suggests specific techniques for cultivating equanimity.
It does.
Like mindfulness exercises.
Yes.
And strategies for setting boundaries.
Exactly.
Imagine a doctor starting each day with a few minutes of mindful breathing.
Right.
Or consciously taking time to decompress after a tough shift.
It's so important.
Yeah.
Those little things can make a huge difference.
Yeah, those little things can really add up.
Exactly.
It's giving them the tools to handle those tough emotions.
Absolutely.
But I'm curious, like, how effective are these techniques in real life?
That's a great question.
Yeah.
There's another news story that brings up some interesting points.
Okay.
About the potential consequences of empathy fatigue and burnout.
Okay, which story is that?
It's the one about the doctor in Muzaffarpur who was suspended for negligence after a patient died.
Yeah, that was a tough one.
It's a tragic case that really highlights the potential pitfalls of an overworked and emotionally drained healthcare system.
It makes you wonder, could training in equanimity, like what AETCOM talks about, have actually helped this doctor?
It's possible.
Yeah.
Maybe it could have even prevented that tragic outcome. It's a thought-provoking question for sure.
It is.
And it really speaks to how important it is to include these techniques in medical education and training programs.
We'll have to dig into that more.
Yeah.
But first, let's take a closer look at this Muzaffarpur case.
Okay.
And see what we can learn from it.
Sounds good. This Muzaffarpur case, it's complicated.
Right.
It's easy to just say it was negligence.
Right.
But it's usually more complicated than that.
Yeah.
The article mentions that the hospital was super overcrowded.
Oh, wow.
Like they were treating patients on trolleys in the hallways.
Oh, gosh.
That kind of environment puts a ton of pressure on healthcare professionals, and that can affect their decision-making.
It makes you wonder if the doctor's mistakes were just genuine errors.
Right.
Or if they were because the system is just stretched too thin.
It's hard to know for sure without all the details.
Right.
But it definitely raises some important questions about the things that lead to burnout and compassion fatigue in doctors. If we're asking doctors to be empathetic and really pay attention to their patients, we need to make sure they're working in environments that support them too.
Absolutely.
Yeah.
A big piece of the puzzle. It is. We can't expect doctors to be like empathetic superheroes if they're constantly under pressure and don't have the resources they need.
Exactly. It's about creating a culture of care, not just for patients, but for healthcare providers as well.
I love that.
Yeah.
This brings us back to AETCOM's focus on equanimity.
It does.
It's not just like an extra thing.
No.
It's essential.
It is.
It's a vital tool.
It is.
For doctors to deal with the emotional demands of their job.
Absolutely.
And protect themselves from burnout.
The module even suggests specific things you can do to cultivate equanimity.
Okay.
Like mindfulness exercises and strategies for setting boundaries.
Yeah, like what kinds of things?
Well, imagine a doctor who starts each day with a few minutes of mindful breathing.
Okay.
Or a doctor who makes sure to take time to decompress after a really difficult shift.
Right.
Those little things make a huge difference.
Those little things can really add up.
It's all about giving them tools to manage those intense emotions.
I love that.
Yeah.
It's like giving them a way to recharge.
Exactly.
So they can keep showing up for their patients.
Yes.
But it can't just be about individual practices.
Right. It's not just about individual.
Yeah.
We need systemic change, too.
Right.
We have to look at the policies and structures that contribute to burnout.
Like what?
Well, things like unrealistic workloads, not enough staff, and all that bureaucracy.
Yeah, all the red tape.
It all adds up.
Yeah.
It's about creating a system that supports everyone.
I agree.
Both patients and providers.
Yeah, it's a big task.
It is.
Where do we even start?
Well, I think it starts with awareness.
Okay.
We need to start talking about these problems.
Yeah.
We need to shift how we think about healthcare.
Okay.
Moving away from just transactions.
Right.
And toward a model that focuses on human connection.
So instead of just seeing a list of symptoms to treat, we need to see the whole person's.
Yes.
Their story.
Yes.
Their hopes and fears.
Absolutely.
That requires a shift in thinking.
It does.
Not just for doctors,
right,
but for everyone involved. Administrators, policymakers, insurance companies, even patients.
Yes, absolutely.
But what about us as patients?
Yes.
What can we do?
That's a great question.
Yeah.
We can't just sit around and wait for the system to change.
Right, exactly.
We have a role to play, too.
Okay, like what?
Remember that story from Mumbai?
Yeah.
Where the woman got compensation because the hospital couldn't take care of her husband? That case showed how important it is for patients to be active.
Right.
To advocate for themselves.
You mean like speaking up for our needs?
Exactly.
And demanding better care?
It's about more than just demanding. It's about being involved in our own care. Communicating clearly.
Right.
And asking questions when we don't understand.
So it's recognizing that we're not just passive.
Yeah.
We're partners in our own healing.
Yes, absolutely.
And I think there are things we can do to make our interactions with our doctors more empathetic.
Like what?
We can come prepared.
Yes.
With a list of questions.
Right.
Be honest about our lifestyle.
Absolutely.
And any challenges we're having with treatment.
Yes.
And be mindful of the doctor's time.
Yes, very important.
It's about realizing that the doctor-patient relationship is a two-way street.
It is.
And we have a responsibility.
I do.
To make that interaction positive.
Absolutely.
And productive.
And speaking of two-way streets.
Okay.
We have to talk about technology.
Yeah, technology is everywhere.
It is.
It's changing healthcare in so many ways.
It is.
Both good and bad.
It's a double-edged sword for sure.
Right.
Yeah.
On one hand, we've got incredible breakthroughs.
Absolutely.
And new treatments because of technology.
But on the other hand, it can make healthcare feel less personal.
Right.
More distant.
Yeah, I've felt that.
Filling out forms online.
Yeah.
Talking to doctors through portals.
It can feel so impersonal. Transaction.
Yeah, it can feel very transactional.
Yeah.
I think that's a valid concern.
Yeah.
If we don't use it carefully, technology can actually get in the way of empathy.
Right.
But it can also be a powerful tool to enhance empathy.
Really?
Yeah.
Oh.
Well, one example is telemedicine.
Go on.
Those platforms that let you have virtual appointments.
Right.
That can be really helpful for people in rural areas.
Yeah, that makes sense.
Or people who have trouble getting around.
Wouldn't that be even less personal?
It could be.
Yeah.
But it depends how you use it.
Okay.
Some platforms let you have video calls, which can help you feel more connected.
Okay.
And some let you share your medical history beforehand.
Oh, interesting.
So the doctor has more time to understand you.
That makes sense.
Yeah.
Instead of spending the whole appointment just getting basic information.
Exactly.
They can actually focus on you.
Yes.
And have a real conversation.
Exactly.
There are even AI-powered chatbots now.
There are.
That can give you personalized health information and support between appointments.
That sounds kind of futuristic.
It does, right.
But can a chatbot really be empathetic?
That's what I'm wondering.
It's true. A chatbot can't replace a human doctor.
Right.
But it can be a really helpful tool for giving information and support. Like it could help you understand your medication or track your symptoms.
Right.
Or find resources for managing chronic conditions.
So it's not about replacing doctors.
Exactly.
It's about using technology to help them.
Yes.
So they can focus on the things that need a human touch.
Precise.
The key is to use technology to support compassionate care.
Yes.
That puts the patient first.
This conversation has really made me think differently.
And me too.
About how technology fits into healthcare.
Yeah.
It's not about accepting or rejecting it. It's about using it thoughtfully.
Right.
To enhance the human element of care.
That's a great way to put it.
Yeah.
It's about finding that balance.
Yes.
Where technology and humanity meet.
Exactly.
Where we can use innovation without losing that human touch.
Well said.
This leads to a bigger question.
Okay.
As technology keeps advancing.
Yeah.
How do we make sure empathy doesn't get left behind?
That's a really important question.
Yeah.
We need to be aware of the potential downsides of technology.
Right.
But also recognize how it can help us be more empathetic.
Yeah.
Ultimately, it's about finding that balance.
Right.
Between embracing new things and preserving what makes us human.
I think that's a great place to pause.
Okay.
We've covered a lot.
We have.
But there's still so much more to explore.
Yeah.
It feels like we've just scratched the surface here.
It's true.
There's so much more to this.
It really is like peeling back the layers of an onion.
Right.
There's always more to uncover.
Yeah. We started by talking about that AETCOM module.
Yeah.
And how it tries to give future doctors a deeper understanding of what it actually means to be a patient.
Right, to see things from the other side.
And then we looked at how those lessons play out in the real world.
Yeah, those news stories from India were powerful.
Those stories about doctors facing violence and burnout.
It's a tough reality.
It really is.
It shows how much empathy can weigh on them.
And that's where equanimity comes in.
Exactly.
That balance is so important.
And like a shield
to
protect them from getting overwhelmed.
I keep thinking about that doctor in Muzaffarpur.
Yeah, that was a tough one.
It's impossible to know for sure.
Right.
But I wonder if that training in equanimity could have made a difference.
It's definitely possible.
Maybe even prevented that tragedy.
It's a question researchers are looking into.
There's more and more evidence showing that things like mindfulness and self-compassion
those are key.
Can really help doctors manage stress.
Absolutely.
And avoid burnout.
Yeah. It's essential.
It's like you can't pour from an empty cup.
Yeah.
Right.
Exactly.
The doctors need to take care of themselves.
Yes.
So they can take care of others.
And self-care isn't just about, vacations and stuff.
Right.
Although those are important.
It's about having the right mindset.
Yeah.
And practices.
To help them stay grounded.
Yeah.
Even when things are crazy.
So you're saying equanimity is as important as knowing the medicine.
I think emotional intelligence is becoming more and more recognized as a vital part of good healthcare.
It's like that saying.
What's that?
People might not remember what you said.
Right.
But they'll always remember how you made them feel.
Absolutely.
And when patients feel heard and understood.
Yes.
And respected.
It can have such a powerful impact.
On their healing.
For sure.
This takes me back to patient agency.
Okay.
That story from Mumbai.
Yeah, where the patient got that compensation.
It really highlighted how important it is for patients to speak up.
Yes.
To advocate for themselves.
It's about recognizing our own power.
Yeah.
In the healthcare process.
We're not just passive.
Right. We're not just along for the ride.
We're active participants.
Exactly.
In our own health journey.
And that means being informed.
Yeah.
Asking questions.
Right.
And being open with our doctors.
This is a two-way street.
It's a partnership.
Yeah.
Like any good partnership.
It needs both sides to contribute.
Exactly.
But let's be real.
Okay.
Healthcare systems are complicated.
They are.
There are always obstacles.
Yes.
That get in the way of empathy.
Things like bureaucracy.
Yeah.
Insurance limitations.
No.
Staffing issues.
What can we do?
Can we really make healthcare more empathetic?
Yeah. With all these challenges.
I think we can.
Okay.
But it takes a lot of different efforts.
Like what?
Well, we need to support policies that put patients first and help healthcare providers.
We need more training programs.
Yes.
Like AETCOM.
That focus on empathy and equanimity.
And maybe most importantly.
What's that?
We need to keep talking about this.
Absolutely.
Awareness is the first step to change.
It is. The more we talk about it, the more likely we are to shift the culture.
And create a system that's truly patient-centered.
Exactly.
This whole conversation has been really eye-opening.
I'm glad.
I feel more empowered to advocate for myself as a patient.
That's great.
And I want to find ways to support the healthcare workers out there.
They deserve all the support we can give them.
Doing such important work.
It's incredibly demanding.
It takes all of us working together.
Yes.
To make healthcare more empathetic.
Patients, providers, everyone.
We've explored some really powerful ideas today.
We have.
About empathy, equanimity.
The future of healthcare.
And we've only just begun.
There's always more to learn.
Thank you for joining us on this deep dive into empathy and healthcare.
It's been a pleasure.
We hope this has given you some new things to think about.
Yes, and maybe even inspired you.
To be part of building a more compassionate healthcare experience for everyone.